Hello, everyone, and thank you for joining today's webinar, Harnessing Local Data for Community Health, Insights from the Marathon County Life Report. We're going to get started in just another minute, and as a reminder, today's event will be recorded. All right. So, hello, everyone. My name is Colin Boylan. I am the Senior Public Health Communications and Engagement Specialist at NACCHO, the National Association of County and City Health Officials. Thank you so much for being here for today's webinar with one of NACCHO's Gold Affiliate Business Partners, Conduent. Conduent provides business process and services and solutions that enable more streamlined and efficient processes, analytics, and end user interactions. Before I introduce our speakers for today, I just want to go through a couple quick housekeeping items. First is that the webinar is being recorded. The recording will be available to all registrants, including the slide deck, by the end of this week. If you are watching and you're here with us, we encourage you to join the conversation. Feel free to post questions in the Q&A or comment in the chat. We'd love to know where you're joining from today, just to get us started. So please feel free to engage, and we thank you in advance for that. And our panelists are going to try to answer as many questions in the Q&A as possible. So without further ado, I'd like to introduce Jane Chai, Community Health Subject Matter Expert at Conduent. I'm excited to be joined by Jane, who will be facilitating today's webinar. So thanks everyone for being here, and let's get started. Jane?
Thank you so much, Colin, and thank everyone for being here. I'm so excited for the webinar. I'll go ahead and introduce myself quickly and what we're doing here today. As Colin mentioned, my name is Jane Chai. I'm the Community Health Subject Matter Expert with Conduent Healthy Communities Institute, and I'll be your moderator for today. A little bit of background on me. Prior to joining Conduent, I actually worked at a local health department for about 15 years and was deep into our community health assessment process, including our HIV needs assessments, as well as a few cycles of our community health assessment and planning process using MAP. So that's why I'm really excited to be with you here today and share some of the real life experiences and lessons learned from a local health department like Marathon County to discuss how we can use local data to improve health outcomes. Some of our objectives for today. First is gaining insights about methodologies and collaborative efforts from the Marathon County Life Report. Also learning how community partners can engage with local data to identify and prioritize health issues. And last, to explore how data findings can inform and enhance public health strategies. I think oftentimes we have trouble moving from data to action, so I'm excited that we'll be able to provide some of that insight today. I'd also like to introduce our two speakers. Anna Clayton is a senior program analyst at NACCHO. Anna is a member of the Public Health Infrastructure and Systems team, supporting local health departments in their community health improvement and performance improvement work. She's also a member of the MAP team, who provides MAP trainings and technical assistance to local health departments. And Erin Ruff. Erin is a public health educator with the Marathon County Health Department. With over 13 years of professional experience in public health, Erin has led community health needs assessments. We also know them as CHNAs or CHAs, and community health improvement plans, also known as CHIPs, and facilitated a variety of community coalition and group planning processes with a diverse array of community partners. He served as staff to community coalitions that address a variety of community health issues, including mental health, alcohol and other drugs, healthy eating, and school-based programming. And as we get started, we'd love to share a little bit about Conduent Healthy Communities Institute. We are a group of public health professionals, multidisciplinary team of public health professionals. And by that, I mean folks with health department backgrounds like myself, folks who've worked in large health systems and hospitals, researchers, data scientists, epidemiologists, and as well as a team of developers and web designers. And over the last 17 years, we've worked with many organizations and communities to implement community platforms and have conducted hundreds of community health assessments and plans. And our approach to community health planning really guides how we develop our technology and work with our clients. And it's through all those years of experience and working with community partners. So first, we really encourage looking at data across the human experience, including health, social, and economic indicators to help us better understand the root causes of health inequities. Each of our platforms has over 150 indicators showing state, national, and trend comparisons. And as you'll see with Marathon County, some of the platforms have much, much more. In addition to those comparisons, we work with our clients to collect and look at their local data by race, ethnicity, gender, location, where that data is available to really explore and examine health disparities in their communities. And finally, our team is really passionate about working across sectors and engaging community partners and community members, especially those that are most impacted by these health disparities. And that's why it's exciting to see Marathon County and what they've done with their partnership. Um, so again, now that we've shared a little bit about us, we'd love to learn about who's on this call and how you're using local data. I think we're going to launch a poll. There you go. So that should have popped up on your screen. And we'd love to hear how much do you rely on state or national data sources like BRFIS, the Behavioral Risk Factor Surveillance Survey, or CHICS, health, uh, health needs survey. Sorry, I forgot the acronym to capture local health and community health outcomes. So we'd love to learn how you all are using it. So not at all. Are you relying mostly on local data collection? Somewhat, we use a lot of local data with some state or national data sources, quite a bit. We use some local data, but mostly rely on state or national data sources, or we do not collect local data. All of our data is from state or national sources. So all of those are valid answers. We just want to learn a bit more about how you're using local data. I'm just waiting to see what the response is. Waiting anxiously, I should say. Ah, okay. I'm going to put this into my line of view. It looks like great. So we're all, most of us, I think, are in the middle. So some not at all. A few of you are not at all and really relying mostly on local data collection. I think most of us are falling somewhere in the middle. So somewhat we're using a lot of local data with some state or national sources, over 50%, quite a bit. So using some local data, but mostly relying on state or national data sources, and a few also not collecting local data at all. All of the data is from state or national data sources. So that's a really great range. And I think it's kind of what we expected, is that most folks are doing something, but maybe with differing experiences. So thank you all for sharing that, and that'll help us proceed, especially for those who aren't collecting any local data sources. Hopefully you can get some ideas from Erin and Anna today. So we're gonna move on into local data collection. So we know that at this time in history, there's a lot of interest in local data collection. And I think, Anna, we just love to kick this off with NACCHO. And, what do you think are some of the benefits of local data collection? What have you seen in your experience?
Yes, thank you, Jane. And thanks for having me. I'm excited to dig into this topic today. So, local data collection is really critical to understand how the unique context of your community impacts their health. So, through secondary data collection, we can understand where the disparities and inequities exist. But through that new local data collection, you can dig deeper to understand what might be driving those inequities. How are community members experiencing them, and what solutions may be helpful to address them? So local data collection has many benefits, including the ones listed here. First, gathering that primary data from populations who are most negatively impacted by inequities highlights their unique perspectives. Primary data collection from community members through surveys, focus groups, interviews, and other methods of direct engagement can lead to more rich and detailed findings. Additionally, having that insight into community challenges and health priorities may set you up to identify more beneficial and tailored interventions that are specific to your community's needs. This data helps you understand what drives those inequities, such as how a person's living and working environment influences their health from their lived expertise. These perspectives may not be reflected in the secondary data, so you're filling gaps in that data collection as well. Lastly, facilitating local data collection might help you build relationships with community members, which is important for building trust and working toward shared power in the process.
Yeah, thanks so much, Anna. I think that is so true. Oftentimes, when we're thinking about local data collection, we're just thinking about the data. But what you mentioned about building trust and the relationships with community members is equally, I think, as important of an outcome of those data collection and analysis efforts. So, thank you for sharing that. I know there's some anxiety about the availability of national data sources at this time, so we hear a lot of our clients looking into some local data collection. So this is some more tools or more ammunition for that or wanting to collect that local data. And I think that's why Marathon County's experience is such a great example for today's webinar, because they've done such a great job of building the data as well as the partnerships. So I'll turn this over to Erin. Erin, could you share a little bit of background about Marathon County for those of us who aren't maybe as familiar with that part of the country, as well as how you've approached local data collection?
Well, thanks, Jane. Yes, I can. I'm coming at you live from our beautiful north central Wisconsin, Marathon County. We are the largest county in the state by land area and home to over 135,000 residents. Our Wausau metro area serves as our regional center for healthcare, education, outdoor recreation, and commerce. Our county is really a blend of urban, suburban, and rural areas with an economy supported by manufacturing, agriculture, healthcare, and education. And today, we are here to tell you a little bit about our story with the Marathon County Life Report. Next slide. So, we're here to talk about the Local Indicators for Excellence Life Report. It's a data-driven depiction about the quality of life in Marathon County that we produce every 3 years. Our latest edition, the 2023 Life Report, was released in June of 2023, and it marked the 13th edition of the report, which dates back to the mid-90s. Powered by Marathon County Pulse, our Conduent Healthy Communities Institute platform, the Life Report exists exclusively online, providing the community an immersive experience in local data, community context, and story. The Life Report is broken down into 7 sections that encompass nearly every aspect of life in Marathon County. The purpose of the report is to acknowledge community successes and progress, identify calls to action, and serve as a catalyst for change by advancing community conversations and partnerships. It has evolved from a printed, static PDF report to a dynamic online resource that combines local data with community context. Next slide. We have to give a shout out to our wonderful healthcare partners. Marathon County Pulse is funded through a partnership of the following community organizations, which you'll see on your screen. We cannot thank our local partners enough for continuing to invest in the platform and making investments in the Life Report for years and years to come. So let's talk about the report itself a little bit and why we ended up with a Conduent HCI platform. So we started the exploration of an online data platform way back in 2015. Like I said before, historically, the Life Report had been a printed 120-page spiral-bound report that was developed every 2 years. Updating all of our data indicators and producing a new printed report every 2 years was a monumental task. Each cycle required us to start nearly from scratch, collecting, verifying, formatting, and organizing hundreds of data points, then compiling them into a comprehensive report. It was an incredibly time-consuming and labor-intensive process that strained our resources and very much limited our ability to keep information current and accessible. Recognizing that there had to be a more efficient and sustainable approach, we began exploring online data platforms that could streamline our workflow and enhance data accessibility. After evaluating several options, we discovered the Conduit HCI platform, a solution that aligned perfectly with our needs and goals. Long story short, our contract with HCI was signed in October of 2017, and our site, Marathon County Pulse, debuted in March of 2018. Later that year, our Life Report Executive Committee made the decision to officially move forward with the 2019-2021 Life Report powered by Marathon County Pulse. Public health educators from the health department, so myself, as well as my colleague Morgan, shout out Morgan, we are the local administrators for the site. We are responsible for updating local data, managing the platform content, and developing the Life Report pages and narrative that brings the data to life. Next slide, please. One of the key benefits of the Conduit HCI platform is the ability to upload our own local data indicators. While the original HCI contract provides access to over 250 indicators, it also allows local administrators to add their own data at no additional cost. We've fully embraced this feature and have uploaded 324 local indicators to our site. We have uploaded a wide variety of data ranging from local youth risk behavior survey data to childcare capacity of our local licensed childcare providers to drug arrests and local crime data. Today, Marathon County hosts a total of 613 different data indicators, 289 that are managed by the Conduit HCI research team, and 324 that we manage here at the health department. Next slide. So let's talk about a little bit about the Life Report itself. It's truly a community effort that involves over 50 local partners to review the data, develop narrative, identify success and progress, and prioritize community calls to action. The Life Executive Committee is led through a strong partnership between Aspirus Health, the Marathon County Health Department, and the United Way of Marathon County, who provide the overall project oversight, planning, and coordination of all of the various Life Report subcommittees. The steering committee is comprised of those members of the executive committee, as well as the chairs and co-chairs from each of the 7 subcommittees, which you can see on your screen. The Life Report really does cover almost every aspect of life here in Marathon County. And the work of those 7 subcommittees are really what drive the Life Report. Those committees are comprised of community experts and local partners for each of those 7. And that's where the fun stuff happens. We'll talk about in a little bit. And that's what we're going to jump into shortly. So I want to just talk a little bit about sort of where we're at right now. Is that we're kind of in the middle of a Life Report cycle right now. We're going to debut our next report in 2026. And we actually used our platform to launch a community engagement and perception survey. It opened in March and it closed just a few months ago in May. We received just under actually 1,800 responses from community members telling us what they thought were the top issues for each of the 7 sections of the Life Report. And so not only is our platform housing data, but it's served as a launch point for our this community engagement survey. And so we're looking forward to producing the 2026 report, where for the first time, we're actually going to have some resident voice. We're going to have insight from our community on what they think the most important issues are. We'll talk more about that later.
Thank you so much, Aaron. And I saw some feedback that maybe my mic was a little muted, so hopefully you can hear me better. I think those are some great examples of local tools and processes in action. I think at this point, we'd love to hear from NACCHO. Anna, can you share some examples of methods for data collection and prioritization that you've seen at NACCHO or can recommend to our attendees here?
Yes, absolutely. Thank you. And really excited to hear about this work from Marathon County. So I'm going to first start by just highlighting briefly the 3 assessment tools from MAP 2.0 before I go into just some kind of quick hits on innovative examples of data collection that we've seen. So these tools listed here are used together in the MAP 2.0 framework, which is NACCHO's framework for community health improvement, to create one comprehensive community health assessment. The community partner assessment is an assessment of the local public health system itself. It reveals the capacities, skills, and strengths of each organization involved in MAP and builds relationships between partners in the process. The community status assessment is a quantitative assessment of the community's health. It uses primary and secondary methods to reveal the status of your community across health, socioeconomic, environmental, and quality of life outcomes. And that's where you can really highlight the inequities and it helps you understand how systems may impact those outcomes. The community context assessment is a qualitative assessment that's really focused on gathering community members' perspectives. So there you can find tools that you may like to use in your local data collection to highlight community members' expertise. It focuses on highlighting the strengths and resources in the community that support health and well-being, current and historical forces of change, and how the built environment impacts health, and how the community has worked to improve health outcomes, all through direct engagement qualitative methods. So these assessment tools can really be tailored to your community and are available within the MAP 2.0 resources that we will point you to a little later. On the next slide here, I have some examples of more innovative data collection methods that we've seen from our work with the field through MAP. So we've seen multiple examples of local health departments who worked with their community partners to facilitate data collection activities, like disseminating surveys and facilitating key informant interviews or focus groups. This was really especially effective when the partner organizations had those trusting relationships with the community that they could build upon for that direct engagement. Additionally, health departments have disseminated surveys in lots of different creative ways, including through QR codes, which I saw in Erin's example there, social media posts, press releases, or text messages. We also continue to learn ways that health departments are working to gather those community perspectives in their assessment. So one example is through Photo Voice, in which participants take photos in response to a question like, what does a healthy community look like to you? And they send a photo from their community. As another example, a rural county used key informant interviews across towns in their county to highlight the unique characteristics and priorities of each, because they recognized that their past assessments had really focused more on the central kind of town of that county and not highlighting all those unique perspectives. A number of communities have implemented walking or windshield surveys with community members to note how their environment impacts their health. And finally, one local health agency conducted asset mapping with community members in partnership with a local organization. So we're really impressed by all the innovative ways that health departments are focusing on gathering community perspectives and innovating their data collection strategies. So as far as thinking about analyzing the data and getting that to your priority issues for your community health improvement plan, looking back at the MAP tools, this is the data triangulation process that comes after you're analyzing the data, getting a summary of each assessment, and working toward prioritizing into issue statements. Prioritizing your issue statements for the community health improvement plan. So the goal of data triangulation is to summarize what you learned from the assessments across 4 themes. What have you learned from them about community strengths and organizational capacity, about systems of power, privilege, and oppression, the status of social determinants of health in the community, and health behaviors and outcomes? So this process really ensures that the priorities to be addressed through the CHIP are based in the data that you gathered from all 3 assessments, meaning it's including that exploration of inequities and the community's perspectives and your exploration of the local public health system and where the needs are there. So this is detailed in the end of phase 2 of the MAP 2.0 handbook. And lastly, just want to highlight the guidance within MAP around developing issue profiles. These summarize those key issues from the assessments. An issue profile includes data about who is impacted, to what extent, in what context, and the root causes. So it really translates the data for a community into what's important to know about this issue, why might it be important to them and to the community to address. This is an example issue profile from the Detroit Health Department, which is referenced in the MAP 2.0 handbook. And MAP includes additional tools such as tips for data visualization and tools for root cause analysis so that you can really highlight the drivers of the issue in that issue profile that you share back with the community.
Thank you so much, Anna. That was so much good information. And I know our team has worked quite a bit with the MAP 2.0 handbook. The upgrade is wonderful. And it's really nice to see this example as well. Erin, I think this is where Marathon County's Life Report really shines by bringing all that data to life and showing what you can do with it and what the calls to action are. Could you share a bit about Marathon County and how you've used the data that you've collected to inform your priorities and strategies?
Yes, thank you. I think the foundation for us is the platform itself. I mean, like I said before, we have over 600 different local data indicators that help inform. And really, it's the combination of all of that data with our subcommittees. And so, like I said before, each section of the life report is developed by a subcommittee of experts. So we work with these subcommittees to examine and select local data, develop narrative based on community context, and identify both calls to action and successes in progress to be included in each respective section of the life report. So I think one of the best things that anyone on the call can do today is go to marathoncountypulse.org. Right there on the main page, you can look to check out the 2023 life report. And as you scroll down that page, you'll see a section that says explore the life report sections. We have used the HCI platform to basically develop a story or develop an issue brief for each of the 7 sections where we take data elements, local narrative, community context, and really sort of set the stage for what life is like. And it's really the combination of the data, the platform, the community that comes together to create those sections. And so it's really become sort of a clear linear process for us to use our committees to identify those calls to action, success and progress, and to eventually prioritize. And so what we're left with at the end of any life report are what we call community calls to action. And so on your screen here are the 5 community calls to action that fell within 4 categories. The purposes of these calls to action is to advance community dialogue and stimulate action to improve policy systems and environment change in our community. Again, these calls to action were identified through community data and context and through the work of the subcommittees and prioritized by a community advisory committee and the life steering committee. So here's an example of what a call to action looks like. Again, I encourage you to check out the 2023 Life Report on Marathon County Pulse, and you can read more about the 4 calls to action: mental health, substance misuse, childcare, and public transportation. So I don't think we said this aloud, but I'll say it now, is that the Life Report does serve as our community health assessment. And data from the Life Report is used to inform our community health improvement plan. So we have carefully curated and structured our life report and our community health improvement plan in a very linear fashion. And so the community health improvement plan is used to help us set priorities, direct the use of resources, and develop and implement projects, programs, and policies. It is required that the planning and implementation process be community-driven, involving community stakeholders and partners. A CHIP is meant to be dynamic, requiring annual review of implementation progress as well as revision to the CHIP to include completed narratives, an emerging health issue, a change in responsibilities, or a change in resources. So the CHIP is really the long-term plan to address the issues that are identified in our community health assessment. So just a little bit of history. How do we actually do this? Is we have, again, carefully curated this process so that once our life report is released, we move directly into our community health improvement plan. And then way back, if we can all remember, in March of 2020, the Healthy Marathon County Alliance and our Marathon County Board of Directors selected health priorities based on the life report. Those health priorities were substance misuse, mental health, and health equity. We had to put a pause on that for obvious reasons, but we came back together in June of 2021 and we confirmed our health priorities and we developed work plans to carry that out for the 2022 to 2026 Community Health Improvement Plan. Again, I'll give a shout out to the Conduit HCI platform. The platform allows us to create and build custom dashboards that help us track our progress. So the screenshot that you'll see here is from our Marathon County Community Health Improvement Plan dashboard. These are measures that our community selected. These are the indicators for our Community Health Improvement Plan. Again, we use this platform as a dynamic resource to not only help us monitor what's going on, but to track our progress and track community outcomes as well.
Thank you so much for that summary, Erin. It's so great to see that you are tracking those outcomes. I think that's where many of our clients can get a little stalled, is when they're moving from the CHA to the CHIP, and even after the CHIP, once it's been finalized, is like tracking both the program level outcomes, but also the community level outcomes. So it looks like you all have done just a beautiful job of doing that in writing and then on the live platform, which so many of our clients do as well. So thank you for sharing. Anna, as we start to close out, on this topic of strategy and strategy tracking, can you share some of the tools for strategy development that is top of mind for NACCHO?
Sure, thank you. So the guidance within phase 3 of MAP 2.0 really highlights steps for developing strategies to address the priorities from your community health improvement plan. So this is a resource called the Community Partner Profile. Once you've brought together a subcommittee of partners to address the priority issue, I heard Erin earlier mention 7 subcommittees that they have. This tool really helps you identify existing work among those partners that could be leveraged to address the shared priority. So you're looking to see, what are our partners already doing? What are they already measuring? So each partner fills out one of these worksheets to share about the work of their organization, including whom they serve, their current programs that are related to the priority issue, and what they're measuring for that program. And that's going to help you identify opportunities to leverage those efforts and data collection related to your priority issue. There's also a focus in MAP on developing transformational goals, which shift policies, systems, and power structures to create lasting change. These are distinct from transactional goals, which address more immediate needs through delivering important services or resources, but do not address the root cause of the issue. So the guidance in MAP 2.0 really helps communities develop more upstream and transformational goals and strategies.
Thank you so much, Anna. And I'll put a plug in again for the MAP 2.0 handbook with all of these tools. They are wonderful. I know we use them with many of our clients. I think this conversation, especially about with the community partners, about the assets that they bring, but also our need for transformation is really necessary and meaningful as we're talking about health equity and our drive towards equity. So thank you for sharing that. Erin, as we start to close out, can you share some final lessons from Marathon County? Any lessons learned, outcomes that you've achieved? I think we're always interested in, those outcomes, and what is next for you all?
Yeah, good stuff. I think for us, we want to make that very linear connection between our community health assessment and the work that we get to do here, not only in public health, but in our various community coalitions. And so we spend a lot of time reviewing and updating data so we know what's happening in our community. We go through the life report process every 3 years, again, leaning on local experts and community partners to help us shape, what is the narrative? What does this mean? What is life like here in Marathon County? We roll that right into our community health improvement plan. I do want to mention that we are big fans of the results-based accountability framework here in Marathon County, and we've used that multiple times, not only in our community health improvement plans, but with other community coalitions as well. So we've definitely leaned on and used the results-based accountability process to help us work through things like result, indicator, factors, and strategy. And ultimately, it leads us to what is it that we're going to do? And so on this slide here, here's just some of the few examples of things that we've done since our last 2023 life report to help support essentially better health or support the community calls to action here in Marathon County. So things like supporting the expansion of school-based mental health, that was a call to action that was identified. We are very happy to provide backbone staff support to the Mental Health Collaborative, a new 501c3 nonprofit that's dedicated to improving youth mental health. We continue to conduct alcohol and tobacco compliance checks for retailers in Marathon County. And I think since the 2023 life report, I think these are both new. We also facilitate our team at the health department facilitates the suicide death review and fatal overdose review team. So again, small examples of work that has spun out of this entire community health assessment and community health improvement process. Let's talk about a couple other lessons learned. One of the biggest lessons we've learned since we've taken this on is that having backbone staff support is key. We as the health department have committed to remaining the local administrators for our conduit HCI platform, Marathon County Pulse. It has transformed the way that we do our work in public health, and we are committed long-term to continuing to be that local administrator. Obviously, the platform speaks for itself. It is a tremendous tool that if you have not checked out, you absolutely need to. It has totally transformed our work. It has transformed the life report. It's become somewhat of an institution here where we can't imagine life without it. So you got those couple of things, and then we have a great community engagement aspect as well. And again, the life report is really hinging on community involvement. And we've seen somewhat of a, I don't want to call it a huge shift, but we're asking community partners and local experts to essentially volunteer their time or to be a part of these life report subcommittees. And maybe, 8-10 years ago, it was sort of a chore to be on a life report committee. And we've sort of seen that turn 180 where people want to be engaged because we provide the backbone staff support, because we have the platform. They don't have to go mine for data. It's all there in front of them, ready to go. And so that's sort of the recipe that we've used here, and it seems to work really well. And I just said it before, and I'll say it again, but honestly, go do yourself a favor. Reach out to Conduit HCI, learn about the platform. It has really transformed the work we do, and I really do encourage you to take a good long look at not only our platform, but there's many others out there as well. It will change your work if you do any type of community health or community health needs assessment. I think I got one more slide here. So let's talk a little bit about what's next. I did mention this as well, but we're sort of right in the middle of our next life report. So we just wrapped up our life survey that ran from March to May. And my colleague Morgan and I, we are updating local data and we're getting prepared to convene our subcommittee starting in the fall. And so from top to bottom, it takes about a full calendar year of work to produce another life report. And so hopefully, let's see here, hopefully by March or I said March, hopefully by April or May, let's push that back. We will have our 2026 life report that will live on Marathon County Pulse.
Thank you so much, Aaron. And it's been such a joy because I think I've seen a few iterations of the life reports, and each time it gets better and more interactive. So It's really been a pleasure to see this grow over time. And I love what you said about, in the beginning, it was a chore for people to serve on the committees. I think folks can really identify with that in the initial phases when we're building the partnerships, there's a lot of skepticism about, will this work turn into something, and will my time spent be worthwhile? And it's obvious that you all have built that partnership and built the trust with your community partners that they believe that it is worth their time. And clearly with the outcomes that you've shown, um, it's been really successful. So thank you so much for sharing your lessons learned and your next steps. I think that concludes the presentation part of this. We have a little bit of time for question and answer, and feel free to type those. I think I've been trying to catch those as they're coming in, so sorry if I've been looking at the different screens. But before we get to that, I want to really thank NACCHO for having us on this webinar. And of course, Erin and Anna, so much for your time and effort in preparing for the webinar and sharing your wisdom from both a local and a national perspective. So really appreciate that. And we'll go ahead and get into some of the questions. So at this time, if you have any questions and you haven't asked them, please feel free to put them in chat. We'll try to get those to the right folks. The first one I am going to field is for Erin. Erin, how have you been able to keep interest? Maybe you just kind of answered this, but how have you been able to keep interest in the collaborative after all of these years?
Yeah, great question. I think it comes down to people. I mean, we have such a strong relationship with our local United Way. The health department, have partnered with them since the beginning, since the early 90s for the Life Report. And they've been supportive of Aspirus Health as well. And we're sort of at a point now where the Life Report is an institution. I know I said that before, but we can't imagine doing our work in public health without it. And so we're definitely biased towards it, and we're going to continue to support it, and we're going to continue to provide that backbone staff and local administrative support. And so for us, it's just, it has fundamentally changed the way we do a lot of our work in public health as far as data surveillance, and I could go on and on and on. So we just can't imagine doing the work that we do without it. And we have plenty of community partners that tell us the same. So there's nothing that brings me more joy than when I'm in a public meeting or community coalition meeting and a local elected official or a community partner is pulling up or referencing the site. So I think we've seen that come full circle a little bit now, where people are using the site, they're referring to it, it's being utilized in decision-making processes or committee meetings, whatever you want to call it. And so it's just it's become part of our community here.
Wow, thank you so much. The next question, and Anna, you might have already answered this, but I think a lot of people might have this question. Can you speak to the alignment to the FAB requirements? I'm guessing the question is about maybe map to the FAB requirements, and then maybe Erin, if you want to tag on to the Life Report and FAB requirements, how you've used that.
Sure, thank you. And thank you for that question. So yes, MAP 2.0 is aligned to the FAB version 2022 standards and measures. We actually released a resource last year that is a crosswalk of how you can use MAP 2.0 to acquire the required documentation across 4 domains of FAB version 2022. So please, you can find that on our nacho.org/map website, that full crosswalk. And MAP is recommended as a framework to use for your CHA-CHIP process to achieve accreditation standards.
Thanks, Anna. Erin, do you have anything to add to that about how you've all done that locally for your FAB requirements?
I'm not going to be as eloquent as Anna, but I think one of the things we're always cognizant of, especially with the Life Report, which is our community health assessment, is there's so much rich local data that we have. And I sort of breezed over that, but I mean, the site, we have data from our sheriff's office. We have data from our district attorney's office. We have data from the Wisconsin Department of Transportation on traffic fatalities. We have data from our local child care providers. So one of our sort of charges was to take all of this really rich local data and make it public, put it on the site. that to me was the hallmark of the site. Is we have we really do, and most communities do. Honestly, you start digging around, there's some really good, rich local data. We wanted to bring that to life and get it out there so people can see it. The second thing too, I sort of breezed over this, but our life survey. And so we've pivoted a little bit. We used to do a simple random survey with for Marathon County residents. We partnered with a local university, and we sort of moved now to a community engagement model where during the period of time that it was open, we encouraged any and all Marathon County residents to take the survey. So we really moved away from that, statistical significance type stuff and just said, hey, we want anyone and everyone to take this survey and tell us what the issues are. And so we did get the 1,800 responses. And again, it's another way for us to engage and get perspective from residents in our community. I think it's going to be a really important tool for our communities or our committees rather to have that this fall to say, hey, we just had 70% of survey respondents tell us that affordable housing is an issue. So I think our main objective in regards to FAB standards and is to really create a well-rounded report that includes local data, input from residents. And then we also got that layer of community experts who are reviewing it and helping us create it.
Thanks, Aaron. And a question came in that I think is related to this is whether your survey uses a random sample or a convenience sample. From what you just said, I think that's a convenience sample. Is that correct?
Correct. Yeah, we used to do the random sample, and to be transparent, I think we mailed out 1,200 surveys and got 400 back. And we sort of looked at it. We've been looking at that the past couple of years. I know there's actually I got to give a shout out to Wood County, who's just to our south here. They switched it up and went to a community engagement model where they opened it up, and we were sort of inspired by that and thought, hey, and that's what we've been hearing too, is for years we heard, when am I going to get my life survey? When am I going to be able to take my life survey? And now we made that pivot. And so it was open to anyone. And I think we got to the point where community engagement was the most important factor, is we wanted to let people in our community tell us what they thought, the most important issues were.
Thank you. And then while we're on the topic of the survey, another question came in, and I think this is to you, Aaron. Can you share more about the community engagement and perception survey?
Yes, I can. I'm sure at some point I'll connect with the NACCHO folks and we'll send it over. But we essentially looked through each of the 7 sections of the life report, and we pulled out what the main issues were from the previous life report. And we essentially asked people, like, what are the top 4 issues for health and wellness? What are the top 4 issues for safety? And so what we have now is data that says, I think I said it before, but 70% of residents said affordable housing was the top issue, or childcare was the top issue. So we wanted to create a survey in which our residents were weighing in on what they thought was important. And so it's a little bit different lens. We've never had that type of data before. It was health behavior data. And that's a lesson we learned as well, is that the Conduit platform is chock full of health outcome and health behavior data. You get that as soon as you sign the contract. And we've also been able to upload a bunch of stuff as well. So we really wanted the community to weigh in and tell us what was their perception. What do you think are the top issues related to those 7 aspects of life?
Yeah, thank you so much. I'm going to shift gears a little bit. This question is for Anna, and it's about the issue profiles. Are the issue profiles created for all issue statements and used to brief stakeholders on what they want to prioritize, or just issue statements that were prioritized to amplify the prioritized needs? Hopefully you got that. So is it used for all of the issues or just the ones that were prioritized?
Yes, thank you for that question. I actually consulted the MAP handbook quickly to make sure I got this right, and I did. They are intended for they are a prioritization tool. So you would develop an issue profile after conducting the assessment, doing the data triangulation process to identify the themes, which kind of turn into issue statements. It's all outlined there in the guidance, but the purpose of the profile is to give your community partners, the community members, a really informed look at each issue so that they have a full, well-rounded view of that before moving into deciding what will be prioritized. But thank you so much for clarifying that.
Thank you. And I'm going to shift gears back again. This is for both Erin and Anna. I think about, I'm reading this as about partnerships and trust building. And it's for a couple of different types of stakeholders. So for Erin, what role do local Congress officials play to inform policy on a state level, as well as to strengthen systems? That's a pretty hefty question, but maybe if you can talk about any efforts that you all have done in terms of like local policymakers and how that's impacted the work that you do.
Yeah, they certainly do. I think one of our main messages that not only the health department gives out, but United Way and others is that we have this platform available. So if our policymakers have questions about local data and or community context, we almost always point them to Marathon County Pulse or the Life Report. We'd be like, hey, you want to learn more about X, Y, or Z? Here it is. Here's what the actual local conditions are. I think that it's a tool in our toolbox at this point where it's full of so much good local data that we want to get that into their hands so they can make decisions.
Awesome. And I'll add on to this question and then give this to Anna first and then you, Erin. In addition to engaging local policymakers, is there also any way to engage researchers from academic or medical school affiliations to build trust? I know you all do quite a bit of work in terms of that partnership building. So Anna, do you have any recommendations or advice for that, for those who are trying to build those partnerships?
Sure. And I have an example that came to mind when I saw that actually. So shout out to Lawrence Douglas County, Kansas. They work with their local university, School of Public Health, and a researcher there a lot on their community health assessment and have leveraged work with School of Public Health students as part of the data collection. So looking at the resources and the assessments and Community Health Improvement Plan, which was just released this year from Lawrence Douglas County, Kansas, might provide a good example of that, of how you can leverage those research resources and also the student body as well. And then just to speak to the question, that's a really great point about working with local policy officials, a couple things came to mind. One being that I think there's a great opportunity there for local officials to leverage or highlight those really specific local stories from each county. So we've seen that, and NACCHO has done that at the federal level, taking specific stories and examples from our counties up to the federal level. But I think that there's really an opportunity there for local policy officials to share those stories, as well as to advocate to the state level. As much as applies to you, we've learned around challenges around lack of inflexible funding for local health departments to use to meet their local needs, and when oftentimes requirements can be added at the state level to funding that makes it challenging to use or to adapt to your local context. So we explored that through a project on our public health finance project, and I'll drop a link in the chat to that webpage. But just a couple things to think about in terms of messages that might be able to be sent up kind of through that connection with your local policy official around more flexible funding to support your community health improvement efforts, as well as highlighting those unique stories.
Thank you, Anna. Related to that, I think we only have time for like one or two more questions. And this is a big one. I think this is one that's kind of top of mind for a lot of us. I'll go to Anna first, and then Erin, if you wouldn't mind chiming in terms of how you've addressed this. In a culture in which data and science is suspect, how do you work with local governmental agencies to address social determinants of health? I'm not sure if that says emerge from the data. So social determinants of health from the data. And maybe a little shout out to you, Erin says this work that's being presented is impressive. So Anna, I'm sure you guys are struggling or managing this as well, is as data and science is maybe being questioned in some regards, how have you helped local organizations work with governmental agencies to address social determinants of health?
Yes, thank you for that question. A very important question right now. One thing that came to mind first was just a resource and kind of tip that I saw recently. I was on a webinar and then at Nature 360 and heard from an individual at the Frameworks Institute who was talking about when we're thinking about stories, kind of the benefits of moving away from individual stories and highlighting individualism and one person's experience through adversity to really highlight all the systems and history that contribute to that, and how when we are raising stories, when we're able to they talked about kind of like broadening the view of that, go beyond that one person to think about all the context that comes into that one story. And that just resonated with me in terms of thinking about when we're communicating about public health, really using every opportunity to share about how the communities and conditions that we live in impact our health, as well as trying to find, this is by no means an answer or a solve, but just another idea is, just thinking about where we can find shared value. So even if it's at the most basic value of just wanting to live a healthy life, how can you build from one shared value that that you have with that, person who's involved in policy or local government or state government, and try to build from there and see where you can get building from those shared values. So just a couple of tips that came to mind, but really appreciate that question.
Thanks, Anna. Erin, I'm curious if you've had to deal with this locally and if you have any words of advice.
Yes. And again, I think we've leaned heavily on the platform to be sort of not the mouthpiece, but we want to bring any and all of that local data, context, and story to life. And that's what the platform has done for us. And so I could think of a few examples. Like in Wisconsin, we have a very robust youth risk behavior survey. So the state has greatly improved their administration of the survey back in 2019. So we get really robust and comprehensive data for both middle school and high school students here in Wisconsin. And so that's one of our big tasks every year, not every year. Is it every year? Every 2 years, is to upload the middle school and high school youth risk behavior survey data. And that data includes a bunch of breakout data by age, gender, race, ethnicity, grade, and even sexual orientation. And so we've used the YRBS is one example, but we use the platform to bring that data to life. And the life report is extensive. I mean, it's basically birth to death and everything in between. And so our goal is to create a well-rounded platform that has data on all of those different aspects of life. And so that's what we've done. I mean, from housing, poverty, you name it, it's on there. And again, I think for us, it's a tool that our community can use or lean on to just become informed. I think in the old days when the life report was printed, as soon as it was printed, it was out of date. And if I misspelled a word, it was misspelled. And now we have a platform that is dynamic. We update the data every single year. We want to keep this data and information in front of people and keep it updated. So that's sort of one of our that's why we in public health, are committed to doing this, is because we want to keep this stuff in front of people.
Yeah, thank you so much. I so identify with that one, typo and being memorialized for the next 5 years. So appreciate you bringing that up. I'm just keeping track of our time and noticing we just have a couple minutes. I think before we close out, we definitely want to promote, share some of the resources. I'll leave this up to Anna and then hand it over to Anna and Colin to close this out for today. Anna, do you want to share a bit about the resources that are available for MAP 2.0?
Yes, absolutely. Thank you. Thank you all for the great questions and discussion. So definitely visit nacho.org/map for all map related resources. You can find links to the handbook and tools to download for free there. There's a Map Network virtual community where you can connect with other map communities, those implementing that for their CHA chip process. There's pre-recorded trainings about each phase and major tool of the process. And we hope to share information about future regional trainings as well. And I'll hand it to you, Colin. Thank you.
All right. Well, thank you, everyone. This was such a great conversation. Thank you, Erin and Anna and Jane, for such a great conversation. And lastly, I just want to remind everyone the webinar recording and slide decks will be sent out by the end of the week. Thank you so much for being here. And thank you to our Gold Affiliate Business Partner Conduit for putting this together with us. Thanks, everyone.